Good day, doctors. Good day, dear colleagues and dental students. My name is Apokim Alexander, and I am a general dentist. And I welcome you on our YouTube Rubberdamology channel, where we show educations for self-learning skills of rubberdam application in the mouth cavity of the patient. Today we speak about different type of rubberdam envelopes around the metal frame. For example, today we work on the upper jaw of our plastic model, and today I show you a new model type with a soft pink plastic base, which I think is very cool to look and touch, and it's have a very beautiful color during transillumination, and it's very good in occlusion. I remove stopper. It's very good in occlusion, and this model made with a company with the name NetSkills. Our clinical situation today: we apply rubberdam isolation from 16 to 26 using two clamps number 20A and 11A. And of course we use rubberdam plates Nicton, the type Nicton medium, which I think the best rubberdam plates at the market today. I switch camera so you can see the old picture of my working place. I fix this model in fixator called fully adjustable articulator, and fix them to my table. First of all, check interdental spaces. We have new model with very strong interdental contacts, but it's very important when you are applying large isolation to check every interdental contact and understand that you have ability to apply interdental rubberdam parts between selected tooths. Then we need to place clamps and check their position. We have very close to real anatomical position and dimension of opening mouth of our plastic patient. Applying clamp number 13A to tooth number 26. Very good and very stable, nice. Applying tooth 13A to the tooth number 26. Very good, also stable. We check stability of both sides clamps with very easy movement of my fingertip. Remove clamps. And start to connection our metal frame with the rubberdam plate. In most cases, it's very comfortable to connect rubberdam plate to frame and did not work with your assistant, which start to make perforations in this rubberdam when your assistant hold it in their hands. I think this is very stupid strategy. It's uncomfortable, unstable, and you will only waste your time and your materials. So connect to frame, very easy, and we made perforations to fix our rubberdam plate in the mouth of our plastic model from 26 to 16. The main idea of making perforations without templates is dividing our rubberdam part inside the frame at the middle. Don't make perforations upper than this quadrant, and then symmetrically make pairs of perforations at the right and left for each tooth. Let's start. Change diameters of perforations for different tooths. Big one for molars, smaller for premolars and canines, lateral incisors and central incisors. It's good enough. Starting from the central incisors. Lateral incisors. Increase diameter of hole on puncture. Canines. Premolars. And again increase diameter for molars. We can use this clamp for first molars or second molars, no matter. And in this clinical sample, education sample, we fix our clamp to the tooth number 16 and 26. It's very easy to start with such kind of isolation because you fix clamp inside the... Let's start. Stretch perforation and put one wing of clamp inside this and stretch it to the other wing of clamps. Repeat this to the second clamp for right side. It's very easy fixation of clamps. Two wings of each clamp at the patient side of a rubberdam plate and two of them for the clinical side of this rubberdam. Now we're ready for fixation. Release two retainers at the bottom of your frame and connect one angle of rubberdam plate with the rubberdam angle. Then fix clamp in the clamp forceps and carefully place this clamp to the tooth number 26. Release your clamp forceps. Find perforations and foramens of the clamp for right side and connect your forceps to this clamp. Take this clamp with your forceps and you're ready to fix it. Fix it to tooth number 16. Very easy. I also working with the fixed model like a patient, so I did not see some angle and aspects. And you must work with the same technique so you can think about geometry, position of tooth, clamps, branches, other perforations. In real patient, we have lips around so we can fix the part of rubberdam at the middle retainer, at the bottom of course, and some aspects that we must perform during our next part of work. First of all, remove rubberdam from the clamp wings. It's very important, and you can help you with the bottom part of your mouth mirror. I don't use fingers to this part of clinical work because it's not possible sometimes to perform this in the mouse cavity because you didn't have enough space. But you always have space for this instrument, probe and the back of your mouse mirror. Very nice. Then of course we need to apply perforations for other tooths. Use floss to make this. Very carefully. Put interdental parts of this Rubberdam plate with floss between plastic teeth and remove floss vestibulary. The next tooth. And the next one. It's very handy sometimes, but sometimes it's impossible because patients have very strong interdental contacts. Sometimes you can stretch perforations and apply it between teeth. It also works sometimes, and it's safe sometime for you for your other clinical work. Very nice strategy if it's possible. When you're working with the Nicton plates, you have very good elastic material of Rubberdam plate, and it's possible to make. Sometimes you can remove floss laterally, but in some cases you can move the other end of this floss vestibulary and remove it. Also, we made some inversion in the frontal area. I think this plastic model is ideal for education. It's very easy to work, and it's beautiful, have nice contacts, and very nice soft rubber gingiva. Very nice. We're ready to work with our next part. In real time, in real clinic, patient can close this tooth like this position, and in many cases it's enough for work in frontal area, in premolars, but very often we need to do something with this perimeter of Rubberdam plate. And my advice to you, to put a small cotton between the nose of patient and this free Rubberdam margin. It's more comfortable for patients to breathe. And the water from your handpiece don't put in the nose. The second advice, make envelope in any case you work. Don't put very hard this part of Rubberdam because you have a great tension at the bottom side above the lower jaw teeth, and sometimes this clump may be loose. So for the best organization of this free Rubberdam margin, I must made less tension between upper retainer and medial retainer, and as low reduce of tension as possible at the bottom retainers, because in sometimes when you put a piece of cotton at the nose, you have a medial retainer which is very strong for feeling by the skin of the face, and maybe it's also useful to put small piece of cotton at the middle and the bottom side of your metal frame. This is much comfortable for patient, and don't forget about these very simple advices. And then after we made this, we made envelope as we made every exercise I show you during this learning course. What is the main aspect of making envelope? Small tension down and press with your fingers, and then cover it with the bottom left angle of Rubberdam plate. Then always hold it with your finger of your right hand outside and remove your finger from the inner part of Rubberdam. Very often my assistant made it symmetrically with me, and until I work with the right side, she worked with the left side. Hold your Rubberdam with finger outside and remove the finger from inner part. And then very often, sometimes I see that doctors made only one fixation. It's not comfortable to work. I never fix Rubberdam at the middle because it's every time work enough. And sometimes it's symmetrically with two hands and two pieces, two fingers. I put to the bottom retainers and I pull Rubberdam outside symmetrically, and I receive very good envelope around my working area. So I can fix suction, and very often I see that doctors who very long time work without Rubberdam made hook like this and put it, but it did not enough to reach the bottom of this Rubberdam area. I like to make hook directly at the other end, so my assistant can put this suction inside Rubberdam area and did not contact with instrument handpiece, and I have a good vision of all area. And very often, typically every time, we remove this cover from our suction, so I have very close contact of suction tip with my Rubberdam plate at the bottom at the clamp arcs, and remove all water from this Rubberdam isolated area. And I think this is very useful during my work. So what I can talk about again is fixation of floss. For any number of tooths you want, you made Rubberdam ligature, floss ligature, to make one loop and make a next loop around the first loop, and you have very good knot, self-fixated knot. Fix it to the any tooth you want. I fix to the tooth number 12. Check position of floss ligature with the rope at the palatal side. It's very easy. And I fix the end of this floss around frame angle, screw, and then fix it with rubber dam, and then back envelope part. It's very fast, and you can change the number of ligatures at the start of work or during your work, or if sometimes you want to remove ligature, you can free it with the probe to remove without touching envelope part. Just remove and continue to work. I hope these small advices. First, remove envelope. I hold frame and free this margin of rubber dam. Remove this part, and then we need to remove, of course, floss ligatures if we're working with ligatures, first of all, and only after ligatures removal you can release and remove clamps. If you have any additional clamps on your patient, remove additional clamp, and only last you will remove anchor clamp. Very carefully hold with your finger inside rubber dam and put or pull rubber dam from vestibular side of all tools symmetrically from the left and right. This is the one strategy. In future lessons, we discuss the other strategies for rubber dam removement in your clinical work. Very important aspect, which is part of patient safety. Check all interdental parts of this rubber dam plate, that you remove all of them. Not one of them stayed in interdental spaces of your patient. Especially important for working with the contact points in premolars, molars, and making restorations in the frontal area. If you stay some part of rubber dam between the tooth, you have local gingivitis. After rubber dam plate removement, you must check that all surface present in your working area and you did not stay some parts interdental spaces. I hope these small advices about ergonomic working with the rubber dam to make comfortable conditions for your patient, for your assistant, and for yourself is useful for you in your practice, in your everyday practice, every hour practice. Because I hope you work with the rubber dam with every patient in every cases. And we made all these exercises and all future exercises in the most complete Rubberdamology course for this goal. If you have any question, please feel free to ask it in the comments below. Thank you very much. See you soon.